Welcome and thank you for joining webinar 3 of a 4-part webinar series titled Self-Testing Strategies for HIV Testing and PrEP. My name is Kendrell Taylor. I'm a manager on the prevention team here at NASDAD. This series aims to share models and innovations from health departments about the implementation of a range of self-testing programs. The series will discuss public health implementation models, which include outsourcing self-testing to a commercial vendor, delivering services through a current public health infrastructure, including CBOs and state public health labs, or a mix of both. Next slide, please. In this session, we will focus on various models currently in place within organizations by highlighting the overall model, outreach efforts, order fulfillment, and resources available to promote within communities. Today, I'm joined by colleagues from CDC, Howard Brown Health in Chicago, and the Iowa Department of Health who will guide discussions and answer questions. This webinar will be recorded and posted for future access. We will also have a chat feature function available and invite you to use this function for any questions or comments during the webinar. At the end, we will have about 15 minutes to discuss the presentation and have questions answered through a live discussion. Questions asked during the webinar will be recorded, compiled, answered, and sent along with the recording of the webinar. But before we get started, we do have our CDC colleague, Maria E. Alvarez, who will say a few words about our partnership with CDC. Maria?
Thank you, Kendrell. Good day and Happy New Year, colleagues and partners. On behalf of CDC's Division of HIV/AIDS Prevention Program Branch, it is my privilege, once again as the Capacity Building and Technical Assistance Lead, to welcome you all to today's webinar. Thank you for joining us today. We really appreciate you taking out time to attend. Also, a special thank you to NASDAD for their ongoing efforts in planning and hosting these state-of-the-art technical assistance webinars, which continue to demonstrate our collaborative commitment to the HIV prevention workforce, partners, and communities as we continue to work together on ending the HIV epidemic. Thank you also to today's presenters from Howard Brown Health and the Iowa Department of Public Health. We are confident this will be another outstanding webinar. In addition, special thank you to our DHAP Prevention Communication Branch. In the spirit of sister branch collaboration, PCB will showcase multiple CDC testing promotional materials and social media campaigns available to assist you to leverage and maximize local self-testing messages. Lastly, thank you to the 1906 recipients who submitted their updated EHE plans by December 31st. CDC remains committed to our ongoing partnership and the provision of technical assistance services. If you have missed any of the past TA webinars, please visit NASDAD's webinar website to access recordings and slide decks. Thank you again, and note we look forward to a productive 2021 and our joint efforts to end the HIV epidemic together. NASDAD, back to you.
Thank you, Maria. Next slide. Kicking off presentations, we do have our CDC colleague, Francisco Ruiz, from the National Partnerships team within CDC to discuss tools available to help promote self-testing from CDC. Francisco?
Awesome. Good morning, good afternoon, depending on where you are coming from. Thanks for having me. Again, I'm going to talk about some of the communication tools that we have, particularly for self-testing and PrEP. I will say that we have resources across the continuum, and I'll highlight briefly some of those and show you some examples of how we work with folks to kind of implement at the local level. So next slide, please. So just briefly, 3 kind of key components of the presentation, really just do an overview of the campaign, again, having a particular focus around our self-testing resources, our PrEP resources, and then we'll kind of highlight some other CDC HIV resources available. I'll show you some examples of how we have supported folks doing the work that many of you are doing in terms of the health communication side of the work. And then I'll have, I don't know if we're holding Q&A to the end, but I do have a part, and if you folks have any questions, you can put it in the chat, or we can meet at the end afterwards. Next slide. Awesome. Next slide. So for many of you who are familiar with the CDC campaign, as many know, in April 2009, we launched the Act Against AIDS campaign, and that was in collaboration with the White House as well as HHS. We have since a decade later have changed the name to Let's Stop HIV Together, so as you can see there on the slide. The New Together branding promotes inclusivity, authenticity, trust, support, and togetherness. Next slide. For the campaign, we have topic areas across the continuum, as I mentioned. So we have resources available for testing, prevention, treatment, and stigma. We have resources that are digital and print available for free for our partners. And those range from videos, poster palm cards, brochures, memes. For healthcare providers, we have continuing medical education offering, patient resources, et cetera. And then we also really focus in on the priority populations that we're trying to reach. And so for just to kind of guide you through the presentation, you'll see there is a URL at the bottom right for most of the slides, and that just kind of has easy access for folks who want to get more information on that particular slide. Next. I wanted to just start off to say that in our materials, we apply a systematic approach. And so we do a lot of formative research in the development of our campaign resources. So that includes looking at the messaging, looking at the imagery. And so we employ that, our advisory work groups, literature review, environmental scans. We engage intended audiences. And so oftentimes that in the past has done focus groups, street intercepts, we've done online surveys, et cetera. We do then concept and message testing that are all theory driven and look at segmented audiences, and then we do sort of a plan. And we oftentimes try to do that in collaboration with our state and local health departments. Next slide. I know many of us are really focusing in on our contribution to the EHE, the Ending the HIV Epidemic. And so I just wanted to briefly highlight how the Together branding campaign is integrating with the initiative. And so as you can see, you'll see as I go through the resources, for our new resources, we're all doing the co-branding with the EHE logo. And so you'll notice that in some of the new assets that are coming out. We're also scaling up our resources. And so we know that there are 4 pillars in the EHE. And so we're making sure that we have plenty of resources across the 4 pillars. We're also looking at our key populations. And so making sure that we have additional resources for populations that maybe didn't have as much in our portfolio. And so, for example, African-American women, and I'll talk a little bit about some new resources coming for African-American women, people who inject drugs, et cetera. We are also prioritizing EHE jurisdiction. I think we're doing that across CDC. And so that's something as we do our media buys, our implementation, we're collaborating with our local health departments as well as CBOs. We are also connecting the dots and collaborating with our sister agencies across HHS and also within CDC. We are working with organizations like NASDAQ and others to really think through ways that we could strategize so that we're all doing our part and really being smart about the employment of our resources, our limited resources. And so making sure that we're kind of connecting the dots. And then just a plug, we do have some resources, as I mentioned, for media buys. And so for health departments in particular who are on this webinar, we want to invite folks to reach out to us and see how we can support your media buys at your local level. And so we have some allocated funds set aside to really supplement some of the media buys that health departments are doing. Next slide. And so here I will get into some of our resources. And so across the portfolio, as I mentioned, we have digital and print resources. And so you'll see here the topic of this webinar, we have some new self-test resources, really just kind of walk through some of the information as it relates to the self-test. On the right, you'll see some kind of leave behind. And so we know that some organizations and agencies are still doing testing at their clinics, at their centers. And so we have some print resources where you can kind of put in some information for the next appointment possibly, or some additional things as it relates to, hey, you check out this page about PrEP or other information. And so we have some of these resources that are available for folks. They're all, again, as I mentioned, free of charge. So just please reach out to us. Again, there's a URL on the bottom to see some of the additional resources. Next slide. We here have this is sort of a kind of Instagram is one of the platforms that we oftentimes use for social media. And so you'll see on the left, it's sort of a video. It's sort of active, but right now I think it's kind of a static image. But it kind of walks through the process. And so you could see on the right there is sort of the walkthrough of how folks use the self-test at home, and so or wherever they choose to use. And so we know that this is sort of new, even though we've been having self-tests available for many years. Many folks maybe have not engaged in this, and so we want to kind of walk them through. And so we have these resources for folks who are looking to put stuff on their Instagram or on their Twitter or on Facebook. And so I just wanted to kind of highlight that, to kind of walk through the easy steps that it takes, because so it can be daunting for folks not having never gotten the test before, never have used a self-test kit, or just it's been a minute. So we want to kind of provide a resource for folks to see how this is done at home. Next slide. So here, just a quick show that we are kind of updated. So for those of you who have been following the Together campaign, or formerly known as I mentioned, Acts Against AIDS, we've done kind of a refresh. And so you'll see there's some consistency that we have across before we used to have discrete campaign, discrete look and feel, discrete names, and now we're coming together under one brand of Together. And so you'll see across the continuum, the resources, regardless if it's testing, if it's prevention, if it's treatment, they're going to stigmatize that they're within the family. And so here you have some resources, some poster images that can be easily used on social media, as well as posted at clinics for those who are still seeing patients or seeing consumers, as well as these could be repurposed and put on websites. And so on the right-hand side, you'll see some palm cards that we've recently developed. On the front side are just some basic messages for key populations. And on the back, we've actually tailored some of the messaging to really kind of hone in on the messaging for that particular audience. And so on the bottom right there, you see some direct kind of messaging for African Americans as it makes sense for that particular palm card. And then the top, I think it's focused on gay and bisexual men. Next slide. This is just to say that in addition to the print and static resources, we have a whole slew of animated HIV testing videos, many of them that talk about self-testing and what it means to get a positive diagnosis. And so these are just some things I kind of put in there, an example of how you could embed these, or you could even look at ways to look at more testing videos. So if you go to our website, there's a little thing on the left-hand side you see there, it says more HIV testing videos. Just click on that and it'll present the whole portfolio as it relates to videos. And these are really easy to grab to put on social media. We have sample social media posts and content so that take into consideration character limits for Instagram, for Twitter, etc. Next slide. These are some testimonials. So in addition to the animated, we also have folks kind of sharing their experience. And so as I mentioned, we do have some resources, particularly for stigma. But even for testing, there's a lot of conversation that needs to happen around what is it, how do you destigmatize getting tested for HIV, as well as some other issues around HIV, like prevention and treatment. And so these videos just kind of walk through the journey of what it means to get tested, why these individuals get tested. These are real people. We have moved away from using models and really have uplifted community leaders and included them across the range of our population. So here you'll see we have a trans man, a trans woman, cisgender men and women, so really representing the communities that we're reaching. Next slide. This slide here are some highlights for our PrEP materials. Again, similar to our self-testing, we have them available in digital and print. So I'll start from the right-hand side, because that has been with us for a few years now, and is actually one of the most popular resources that we have from the Together brand. And so it's a PrEP, kind of gives you 101 fact sheet. These are kind of folded up in sort of a nice, easy way to put in your pocket. These are also, we developed an animated video that walks through the process, this infographic brochure. And so that's available also for folks to use, again, on platforms and on websites. The top left, you see your PrEP is a Daily Pill. That is a brand new prevention resource that we have launched over the past month. We have a whole group of resources around sexual health and prevention and PrEP, et cetera. And so you invite folks to check out that. And then you see there on the bottom left, it's just an example of some resources that we have available for organizations who are trying to be sort of, engage or looking to engage community members. And so we have kind of a trivia Q&A sort of resource that you could put on Instagram, on your stories, or on Twitter, or on Facebook. And so just wanted to highlight one of many sort of different social media content that we have. Next slide. And I know that the focus isn't on treatment and care, but I wanted to make sure just to emphasize that we do have a portfolio of resources here. And so you'll see we have videos, we have kind of a roadmap to being undetectable. We have additional, similar to the previous materials, posters, palm cards, digital banners, etc. So I just wanted to just quickly feature that. I'm not going to say too much on this one, but we have that undetectable poster in the middle. Also, as I mentioned, like similar to the PrEP resource, this is also developed into an animated video that kind of walks folks through that journey of becoming undetectable. Next slide. And now just kind of flipping a little bit to the healthcare provider side. So we know a lot of health departments and organizations are working with healthcare providers. And so I just wanted to mention and put a plug in that our HIV Nexus is sort of our one-stop shop, as you can see on the slide. It has the latest and greatest research. It has information related to CDC guidelines, related to prevention, screening, and treatment. We offer and kind of curate some of our continuing medical education offerings are listed in the Nexus. We have a whole slew of resources that are directed for healthcare providers in addition to patients. And so the next slide, you'll see some examples of the resources that we have available. So you'll see on the right-hand side, we developed sort of a guidance document that kind of really repurposed the DCL, the Dear Colleague letter that was issued from the CDC related to HIV testing and PrEP services during COVID. So that's available for folks to download and use. We also have some examples of some social media assets that we've developed that are also available for folks to use related to PrEP care in times of staying at home, et cetera. Next slide. Another set of resources, again, these are particularly around PrEP. And so you'll see we have some materials here that are not only available, are useful for healthcare providers, but also for patients. So we have brochures that provide detailed information about how PrEP prevents HIV, including the regimen, side effects, and safety. We have another brochure that has useful tips on what to ask your healthcare provider. So this is geared towards the consumers and patients. And then we also have some resources that talk about how folks can pay for PrEP. And then again, as I mentioned, we have some resources related to social media around CDC guidance around PrEP services via telemedicine. And then also, again, mentioning the CDC DCL guidance around prescription of 90-day supply of PrEP. Next slide. Hopefully I'm not going too fast, but in case I was going too fast, I did want to mention that we've kind of updated our Together website. And so we've tried to make it user-friendly. So this is just to say that if you go to our Together website, the URL is on the bottom there. You can kind of use whatever you're looking for. So if you're looking for a particular topic area, let's say testing, let's say treatment, if you're looking to reach African-American community, if you're trying to reach gay men, if you're trying to get information as in English or in Spanish, if you're trying to get videos, if you're trying to get palm cards, there's different ways that you can kind of filter. So I just wanted to kind of briefly mention that. So I presented some of the resources, but we have a whole collection of different resources for folks that are available and be able to download. And if you see something you like, please feel free to email us. I have my email at the end so we can send you the files as well. Next slide. So in addition to the Together campaign, I did want to mention that the CDC or DHAB, we are kind of collecting and developing a database that is particularly focused on self-testing services. And so on the right there, you see kind of a screenshot. I clicked on Tennessee. So those are the services that we currently have information for in Tennessee that have self-testing services. So I just want to, you see the URL there on the bottom. Just want to mention that this includes services that are free or at a reduced cost by jurisdiction. And so I will say, as you go on this website, we encourage folks to do that. You see that your agency possibly is not included. Please feel free to email that email address, hivwebmaster@cdc.gov, excuse me, and somebody will get back to you and kind of get your information. We're looking to integrate the self-testing service database into the larger NPIN comprehensive HIV service locator. So as you know, we have a series of widgets and locators. And so we're looking to integrate the self-testing service database into that. And we're estimating that around May. It takes a little bit of some back work that happens. But again, just want to plug, if you go on the website, don't see your agency, please feel free to email us directly and we'll work with you to add your information. Next slide. Excellent. So this is just, again, not necessarily Together or campaign specific, but just wanted to just mention that we have updated sort of the HIV basics. to really hone in on HIV self-testing. And so as you can see throughout the campaign resources that I've mentioned, we're moving away from home testing and using the kind of terminology self-testing, because words do matter, and making sure that we don't want to stigmatize folks who potentially are experiencing homelessness, et cetera. And so you'll see some of the information related to our Q&A kind of highlighting things, self-testing. And so just wanted to mention that we have just updated information. You can see on the right there, we have some examples of the rapid self-test and then the mail-in self-test, and kind of different questions that folks may have related to that. And so these are all kind of easy to grab and put on your website, put on your social media platforms. So I encourage folks to look at that. Next slide. Just wanted to put in a plug. I try to do this every time I present in front of folks. It's a resource that I don't know if that many folks know of. We have a thing called content syndication. The URL is down the bottom. Essentially, it's an opportunity for you to, you do this one time, and then it's, until you change your mind, it will be updated regularly. And so basically it pulls CDC information to your website. You do something on the back end. I'm not going to pretend to be an IT person, but you put something, you kind of organize yourself on the back end. And this is really important for organizations who don't necessarily have webmasters on their teams. They do that maybe on a contract basis. You set this up, you don't have to worry about kind of pulling in that contractor again, because once you set it up, it's set for, and people stay on your website. So the look and feel is similar to, the color fonts and treatment that you have on your particular website. So we're happy to answer any questions related to this as well, but this is a great resource for those who are looking to put more information. So every time CDC updates our stuff, automatically will be updated to yours. Next slide. And then just a plug, I know NASDAQ is intimately involved in this. I just want to mention that we are working in collaboration with many folks around the SelfTesting Project. And so it launches officially, I believe, February 4th. And all I wanted to say, particularly for this call, is that we are developing the PCB, the Prevention Communication Branch, is developing some promotional materials for this initiative. That said, we are happy to share some of these resources with folks on the call who are also doing and pushing their self-test programs. And so just wanted to mention that. Next slide. And then just briefly, I know that my time is coming up. I want to show some examples of how we've collaborated and type of services that we offer in terms of implementation. So next slide. So this is a slide that I often use in terms of kind of the scale, in terms of from least to most complex. And so we have either you utilize, kind of use as is, localize, do some slight modifications, or adapt and really kind of think through some local tailoring. And so the next three slides kind of walks you through these three different kind of opportunities that we offer at CDC with our Together campaign. Next slide. So this is just an example. So you see here some examples related to utilize. So a lot of organizations, health departments have just kind of requested our free materials, have done exhibits at their respective meetings, events, their centers. And so they see the first picture there, just an example of resources that are available for you to use at your respective places and events. In the middle there, you'll see an example of one of our partners, LULAC, who uses our digital banners on their website. They also have embedded some of our videos. So this is just an easy example of an easy way to put some kind of collateral, some imagery, break up the text on your website. And so oftentimes these banners could be coded, and so people click on the picture and they could go to the information related to that topic area. So just an example of somehow folks have kind of used our materials as is and put it on their website. And on the right there, you'll see some examples of social media. So we are always developing social media toolkits. We do those for awareness days. We have one coming up. And so that this kind of, it's really easy. Like I mentioned before, we take into consideration the character limits, the sizing required for social media platforms. So that's an example of some health departments using our resources. Next slide. Now we go into localize. And so these are just some quick examples. On the left-hand side, you'll see circled the image with the family there is actually a video, so it looks kind of weird what's circled now, but at the end of the video, they added sort of their information to the health department, and so that's what was being circled. But if you see it in the video, you'll see what I'm talking about. So we've worked with this is in particular, I think it's Philadelphia Health Department, where they use our creatives. So again, you're saving money. You don't have to develop the resources. All you're doing is doing some slight modification, adding your logo, adding your hotline, adding your website, etc. But then you could really employ your limited resources for the implementation, not so much for the development. And the right-hand side is just an example of oftentimes we get invited from health departments to their grantee meetings, or we'll Pride events. So just an example of how you can use some of our materials. So in this instance, you'll see one of our team members presenting our portfolio and then walking through some activities and developing work plans related to using the Together campaign. Next slide. Here, this is the little bit more, the most intense, I would say, as relates to implementation. So we oftentimes hear that it's important. We think it's very important to have local leaders represented in campaigns, especially the ones that are being localized. And so this is just one example. On the right hand, you see kind of our original Together campaign, our testing campaign, doing it. On the right there, you'll see we worked with the health department here to identify local leaders. We got local quotes. And then we added their logo. So this is just an example. So for those of you who maybe want to do some additional tailoring, all you really do in this instance, just identify some local leaders, do your photo shoot, and we'll work with you to kind of put it into the template. So again, you don't have to worry about developing your own set of campaigns. Just really using your local leaders and finding ways to implement the campaign at the local level. So this is just one example. So the resources are, again, minimal in the sense that you just hire a photo photographer, and then we work with you to kind of plug it into the template that we have for the campaign. Next slide. That's it. I'm not going to read this slide, but essentially I just want to say we have a series of resources. We've done our formative homework, our formative research. So if you're trying to reach Black gay men in the South, we may have research for you to kind of help you inform the messaging around that. Just wanted to mention that. As I mentioned, we have a whole slew of resources across the portfolio. We have some community ambassadors who are leaders in the community. So if you're doing events, if you're hosting virtual events, we're happy to engage them and have them join you for your virtual events. We have some tools and templates for those who are trying to evaluate the Together implementation. And so we could help you kind of identify that. We know that's really important when you're doing reporting, et cetera. And then we are offering TA, technical assistance, in collaboration with TBB, with NASA and others to help implement our campaign. Next slide. Again, I think I'm close to the end of my slide deck, but this is just how you could get connected to us. And so for those of you who are directly funded by CDC, by DHAV, reach out to your partner office so they know how to get a hold of us. Or feel free to email us directly. That's our campaign email. We monitor that daily, stopHIVtogether@cdc.gov. For those who just really want to download materials or get print materials, we do have most of our resources available at CDC Info. If you go to this website, you see a resource is unavailable, then shoot us at the email, because we can maybe send something to you that maybe if our the quantities are depleted at CDC Info, but we're trying to constantly monitor that. And then we have, lastly, a kind of a place on our website to be able to put in your information and think through ways, and we can work with you and strategize how we can become partners. So with that, I think I go to the Q&A, but I will pass it over to the next presenter.
Perfect. Thank you, Francisco. Lots of information in a short amount of time. You did a great job giving us the overview of materials and resources available and strategies for social marketing. So in lieu of time, next we have Liz Thompson and Janelle Klein from Howard Brown Health, who will discuss a modified version of express visits, which assist in integrating no-contact lab visits to PrEP clinical care and support services. Liz and Janelle.
Thank you. So I'm Liz Thompson. My pronouns are she, her, hers. I'm the Associate Director of Public Health Promotion at Howard Brown, and I'm joined by Janelle Klein. Pronouns are fair, fairs. Janelle is the Manager of Biomedical HIV Prevention Interventions. Next slide. So today we're going to discuss how our Express program was pre-COVID and how we've had to revise its structure to support COVID-19 precautions and the safety of our patients and staff. I'll also give you an overview of how we implement PrEP care at this time during COVID-19. And Janelle is going to describe how we're able to promote PrEP during the pandemic. Next slide. And really quickly, Howard Brown Health exists to eliminate the disparities in healthcare. Sorry, the slide is different on my screen. So the disparities in healthcare experienced by LGBTQ folks through research, education, and the provision of services that promote health and wellness. Next slide. All right, so our express clinics, the goal here is to increase access to HIV and STI screening. Basically made the process quicker, more seamless, and we've established express clinics in more community-oriented, less contiguous settings to better accommodate folks who feel uncomfortable visiting a clinic or who may want to keep a low profile. So our express clinics are located in a community center as well as a resale shop in our south and west sides of Chicago. Next slide. So this is what the express clinic looked like pre-COVID. Again, that first picture that you see up there is what the patients encounter when they walk through the door. It's doesn't really present as a clinical setting. There's no front desk. Patients will register through a kiosk with a platform that we use called HealthVana. We offer rapid point-of-care testing for syphilis, HIV, Hep C, and also offer gender-neutral bathrooms so that patients can self-collect for gonorrhea, chlamydia, urine, and swab specimens. Next slide. So once COVID-19 hit and the shelter-in-place orders went into effect throughout the year, we've had to make some adjustments. So unfortunately, we've had to reassign our express clinic sites for community COVID-19 screening, but we are still able to offer low barrier HIV and STI screening services at 2 sites in our north and south sides. We've also had to shift away from the walk-in model. So we now offer appointment-based slots for HIV and STI screening. Most of these appointments are same day, although folks are able to access next day appointments. And the reason for this is so that we could really limit the number of folks that are coming in and out of the clinic, the number of folks that are waiting in our waiting areas or congregating outside of the building, just to make sure that we're honoring COVID precautions and keeping our staff and patients safe. So when patients are in clinic, they have minimal contact with staff. They basically come in and have a lab visit where we conduct phlebotomy and collect specimens for STI and HIV screening. And telehealth visits are conducted for health education and with providers for PrEP care. Next slide. So for our PrEP care, folks are able to register through HealthVana to limit contact with front desk staff. They can register in advance through their cell phones, and we also have kiosks at our clinic if folks are experiencing any barriers with technology. We have on-site staff that can assist with this if needed. And with HealthVana, folks can also access their lab results as well. We have PrEP navigators that can assist patients with making appointments for their PrEP care. They're able to set up telehealth appointments with providers as well as their lab visits. Next slide. So with telehealth, patients are able to visit with a provider. We use Zoom over their phones. We do offer in-person visits if there's a technology barrier and patients aren't able to access that platform. When they make an appointment, we also make sure that a lab visit is scheduled within 7 days advance of the telehealth appointment with the provider. Next slide. And then to support PrEP navigation and retention services, our PrEP navigators are able to offer their services virtually. They do provide support over the phone And all of the financial assistance applications are submitted digitally, like through Gilead or Vive. And for additional support to help with PrEP retention and care, HealthVana offers a program called PrEP Care Plans. The PrEP Navigator, if the patient's interested, will enroll them in this plan, and essentially they receive periodic text messages with tips for medication adherence or information about potential side effects, as well as appointment reminders. Next slide. I hand it over to Janelle.
Right. Hello, everyone. My name is Janelle Klein, and I am going to just take you through how we're promoting PrEP at this time. So the majority of our PrEP promotion is being handled through outreach and through geosocial networking apps. Right now, we primarily focus on Grindr, Scruff, and Jacked. We have profiles set up on all of these accounts, and we have the hashtag #PrEP2Play, and we do this outreach for 3 hours a day, 3 days a week. Right now is what we are allotting for this type of outreach. We've currently connected 25 patients to PrEP in the month of December. In the month of December, we also, next slide, please. Perfect. And so in the month of December, we also were able to connect with, I believe it was, I might have it on the next slide. I believe it was 172 folks. And so through these apps, this is what our profiles look like. We make it very clear we're here for outreach purposes only, connecting folks to no or low cost PrEP. We try to get as many of the groups that are available in our profile as well. This is an example of one of our communications that we were able to have with a person. And so they asked what PrEP is. We were able to kind of discuss it with them. So a lot of the times when folks are reaching out, they're asking what PrEP is or how to access it, how much it costs. If they are interested in coming into the clinic to get started on PrEP, at that time we send them the link so that they can register through our HealthVana site, so that we're not asking them for their personal information through the apps, and then we just follow up later and make sure that they're getting that appointment and that they're scheduled appropriately. Next slide, please. Oh, perfect. All right, and it looks like we are ready to hand it off to our next presenters. Thank you.
Perfect. Thank you so much, Janelle and Liz, for that information. Amazing work is being done at Howard Brown. As we end presentations, Cody Schaefer from Iowa's Department of Health will discuss fulfilling orders for an at-home testing with tailored HIV prevention and virtual linkage to care and other supportive services. Cody?
Great, thank you, Kendrell, and to my fellow presenters, thank you for your incredibly interesting presentations. I know I'll be following up with a couple of you on some things, so I look forward to that. As Kendrell said, my name is Cody Schaefer. My pronouns are he, him, and his, and I'm the Prevention Services Coordinator with the HIV Special Projects Division, working here with the Iowa Department of Public Health to implement Iowa's suite of HIV and viral hepatitis prevention programming. Next slide, please. And just a little overview on what I plan to talk about today. I'm going to give a little background on Iowa. I always like to do that with national folks, so you have a better understanding of the environment that we are addressing here. And then I want to talk about a couple of our different home testing initiatives, starting with the home testing that was implemented as part of our Iowa TelePrep project. The home rapid HIV testing initiative that we've been implementing in response to COVID-19, discuss lessons learned from both of those, and give you a sneak peek on what we are planning for home testing in 2021 and beyond. Next slide. And we can go one more. So just to start with our background on Iowa, this is a 2019 graphic illustrating the distribution of HIV in the state of Iowa. So Iowa is a very rural jurisdiction. We have 99 counties. And as you can see, our 10 most populated counties are indicated on this map in red and represent 73% of our HIV burden in the state. So unlike some of our rural neighbors where we see a large proportion of HIV diagnoses consolidated into one major metropolitan area, we have our disease burden really distributed equally across the state, with 27% of the disease being in our 88 highly rural counties across the state of Iowa. As you can imagine, this creates some challenges in terms of building and scaling infrastructure that can meet the needs of individuals, both in terms of HIV prevention and HIV treatment. And this has motivated us to look at models of service delivery that can scale over large geographic regions to serve these individuals without the cost of expanding brick and mortar infrastructure. Next slide. So the traditional testing initiatives that we use here in the state of Iowa are outlined on this list that I'll go over here, and then I have a couple of maps I'll share with you. Our primary mode of testing is what we call our integrated testing services contracts, and these are our really traditional rapid HIV testing partners across the state. We have 10 of these that are historically funded, and then 2 that have been added on that are funded through alternate mechanisms. Many states call these CTR, counseling, testing, and referral contractors, and it's really what you think of in terms of our traditional CDC-funded rapid testing and case finding activities across the state. And if you remember that map that I just showed you with our 10 most populated counties, those are where our 10 contractors are that we fund to conduct these services. A few years ago, we also partnered with the Iowa Pharmacy Association to begin implementing community-based pharmacy rapid HIV testing in areas that were uncovered or undercovered by our integrated testing services contractors. About the same time, we scaled up our relationship with the Iowa Primary Care Association, which supports Iowa's federally qualified health centers in an effort to increase routine screening for both HIV and hepatitis C and FQHC settings across the state of Iowa. And then we also have a very robust, what we call community-based screening services program. And these are our network of family planning and other community-based organizations that implement our state's STD screening, or our safety net STD screening here in the state of Iowa. And I'll just say that all 10 of our integrated testing services contractors are also community-based screening services sites, which is why we use that integrated moniker, because we're really integrating HIV, hepatitis C, and STD testing at all of these sites. Next slide. So this map you see here is our 2021 service region map for our integrated testing services program. So as I said, our 10 contracts are in our 10 most populated counties. And a few years ago, we had the opportunity to braid some of our funding with other federal funding sources, which supported the expansion of testing services into service regions, meaning that we have folks now advertising, doing condom distribution, and traveling to do pop-up clinics or event-based screening as needed throughout the service regions that you see here. And while we have scaled up dramatically over the last 3 years in terms of how we're administering services across the state of Iowa, you can see that there are many counties represented in this map in white or uncolored that are not served or serviced by any of our existing contractors. Next slide. And then to overlay all of our services here, the green dots that you see are STD clinic or community-based screening services partners. The pink and blue triangles are where we have rural community-based pharmacies located. The orange starbursts that you see are federally qualified health centers that are participating in our routine screening project. And a county being fully shaded just means that it is serviced or served by an integrated testing services partner. We also conducted a vulnerability assessment here in the state of Iowa. So you can see there are counties outlined in green, red, and yellow. Those counties outlined in yellow were determined to be vulnerable for an HIV or hepatitis C outbreak related to injection drug use. The counties that you see outlined in green are counties that were identified in that assessment as being vulnerable to overdoses related to injection drug use. And the counties that you see outlined in yellow are counties that were concurrently identified as being at risk for overdose and outbreak related to injection drug use. And this is all to say and to illustrate that we have a really unique situation here in Iowa, where we have a lot of counties that are covered to some degree with our existing or expanding infrastructure, but we also recognize that there are a good number of individuals across the state who don't have access to our services that need them. And all of this information has motivated Iowa's pursuit towards different service delivery models like telehealth and at-home testing. Next slide. So really, our foray into telehealth and home testing started in 2016 when we launched the Iowa TelePrep program. Next slide. And Iowa TelePrep is just a direct provider to patient telemedical PrEP delivery service that was started in 2016 with some support from the state health department here in Iowa in partnership with University of Iowa hospitals and clinics. This operates under a collaborative practice agreement with clinical pharmacy specialists that provide care to patients utilizing telemedicine. This service is free because it's grant funded, so there are no costs for medical visits. There's no cost for the technology. We use video. But patients have to access labs on their own, and obviously we have to run insurance or copay assistance programs for the cost of medications. We were very lucky to be funded as a Component B project under PS 18-1802 through CDC to scale this project to cover the entire state and to study TelePrep's uptake and efficacy in partnership with the state health department. But in terms of labs for this program, we've always really relied on our public health infrastructure partnerships to collect labs for individuals who are accessing PrEP through our TelePrep program, meaning that individuals can go to any of our community-based screening services or integrated testing services partners to access rapid HIV testing, rapid HCV testing when necessary, and then also to obtain 3-site STD screening and other laboratory studies that are required for PrEP, and to be able to do this at very minimal or no cost to the patients. Patients with payers or who are electing to pay out of pocket also have the opportunity to use commercial labs through this process. But we have found that we prefer our public health infrastructure to commercial labs because of our ability to obtain 3-site screening is incredibly limited in a commercial lab setting. So even with these vital partnerships that were integrated as part of the design, there were identified gaps in accessibility related to testing as part of this service early on. Next slide. So in order to try and respond to those gaps, the Iowa TelePrep team partnered just a couple of years ago with the team over at Emory University and the Center for AIDS Research to implement home testing for a select number of patients in an attempt to better understand the acceptability and feasibility of a centralized distribution of a PrEP lab kit in partnership with our telemedical PrEP program. So if you're familiar, Emory's test kit was a 6-step at-home test kit. It was only available for our male patients. Delivery was done by Amazon distribution, so it addressed issues related to stigma and privacy concerns in rural communities. Samples were returned by mail. So we did this with about 100 of our patients, just to dip our toes into the home testing or self-testing world and see what we could do with that. And we did it just by offering a home test kit option to folks who might be interested in it and who were already patients of our TelePrep program. 45% of our clients who were offered the kit elected to use at-home testing instead of a lab visit. And interestingly, 82% of those who accepted the at-home test kit lived within 15 minutes of a public health infrastructure lab access site. And we found this particularly interesting because we thought that access to local labs would be the barrier for individuals accessing labs, and assumed that it would be the motivator that would direct folks to using the at-home option. And what we found through our evaluation process is that local labs were actually stressful for individuals to access, especially in our smaller and more rural communities, due to stigma and privacy concerns that are persistent in rural areas. We did do a very comprehensive evaluation of this project, and it is in manuscript form and is going to be published in the Journal of AIDS and Behavior. So that has been accepted and the publishing date is pending, but I did just want to give you all insight into that, and we'll be sharing that published manuscript with the folks over at NASTAB. Once it has cleared publications, it'll be available for your reference. Next slide. So we knew that this was working for our TelePrep space and how we were supporting retention and care and laboratory monitoring completion rates for individuals who are in our TelePrep program. And so last year we started really thinking about how we could pivot that to utilize those lessons learned to implement rapid HIV testing at home. And it had been our plan to start implementing that in 2021 to give us some time to plan and get up to speed and build the infrastructure that we were attempting to pursue. But as with everyone, COVID-19 changed the game for us, and we identified an opportunity to do a rapid pilot implementation of HIV testing at home in partnership with some select contractors across the state, again, to just dive a little deeper and see if there were relevant lessons that we could learn to inform future program design and implementation. Next slide. So in response to COVID-19, we quickly acquired OraSure's OraQuick Rapid HIV Test Kits, very much in line with the guidance that CDC was giving out at the time. We identified 2 of our traditional integrated testing services agencies, as well as the Iowa TelePrep program, to pilot utilization of this test kit. And in the initial design, it was really meant to be offered as an alternative to in-person clinic requests, both for HIV status monitoring amongst individuals who were in PrEP care, and also just for routine HIV screening that was happening at our integrated testing services agencies. We designed this to require a phone pre-screening to complete the CDC client assessment. And we know that this wasn't required through the guidance that was given by CDC, but we did choose to try and measure the acceptability of this because we really view that client assessment requirement as a counseling tool that allows us to identify a client's individual and unique needs and make appropriate referrals and provide additional supplies or information in a supportive way. And we really didn't want to lose that capability by switching to an at-home model. So we did decide to keep that as part of our pilot infrastructure, pilot design. And I will say that it did work very well in these settings. So the way that this process really works is that individuals who are calling the clinic to seek in-person testing would be offered an at-home HIV test rather than having to come into the clinic, same clinic environments where folks are being treated for HIV and other primary care needs, as a way to reduce clinical burdens during the COVID-19 response. So they were offered the test kit, they would complete a pre-screening and do their client assessment over the phone, engage in prevention counseling during that phone call, and that information would inform the test counselor on what materials or information they'd be putting in the box with the test kit that they would be shipping out to the patient. So I'm sure you can assume now that we decided to purchase physical inventory and manage shipping on our own rather than purchasing codes from the distributor and being able to dispatch kits from their dispatch center. And this did prove to be really effective because we were able to identify a good number of individuals who needed additional support services, safer sex supplies, or referral information. And because we were mailing the kit, we were able to include that with the kit at the time of dispatch. And then also referrals to PrEP and other services were obviously made as part of the assessment. We asked clients to report by text or phone to the issuing agency what their test result was, preferably in the form of a photo of their test result. And I'm happy to report that utilizing this model, all but one individual has successfully verified and reported their rapid test result to the agency that supplied their test kit to them. We are still early in this phase, so we started July 1st of 2020, and we have extended now this pilot through March 1st of 2021, and we're using our lessons learned to identify a more scalable phase 2 of the pilot to cover the entire state of Iowa as we move through 2021 before we decide on formal sustainable implementation of at-home testing as we move into 2022. Next slide. But there has been some progress in learning as we've implemented these pilots, and I think that these are important things to know. And the first is that offering home testing as a clinical alternative yielded incredibly low uptake. What we found is that folks who had been going to clinics for routine screening for long periods of time, they had relationships with their test counselors, they were willing to wait for limited appointment availability to show up in person and have that test done. I think that speaks a lot to the capacity of our test site staff who are in the field every day doing this work and the relationships that they're building, both at the individual and the community level, that folks were really willing to work around their COVID schedules to be seen in the clinic. And we realized that really early on in the pilot. So we shifted focus pretty rapidly to start doing scaled up focused advertising, utilizing social media, and then also apps like Grindr and Scruff and those more traditional MSM outreach mechanisms that we use. And what we found is that that version of implementation for our Rapid HIV at Home program yielded the most or the best results for us. Interestingly, 34% of everybody who's used our at-home test kit was rural, meaning they resided outside of one of those 10 most populated counties that I identified in the map at the start of my session today. But a third of those were men who have sex with men who had never been tested for HIV or who were uncertain of their HIV testing history. And also 66% then were urban, and a good number of those also identified that they hadn't been tested within the past 12-month period. So we can see that at-home rapid HIV testing, even with the phone-based screening tool that we're utilizing to collect that client-level data as part of our Affirm process, that we are capturing individuals who are at increased risk or are vulnerable for HIV and who need to be screened and referred for other services. So we've learned that lesson, and that's what's motivating us to move through phase 2 of that pilot and to scale that up. But we will continue to ship directly from whatever partner we're working with and to do the client assessment so that we can inform what information, tools, and resources need to be included with the kit during the distribution process. Next slide. So all of this is to say that over the last couple of years, we feel like we've tried a few different things and learned a lot of very invaluable lessons about implementing home-based testing, both for HIV, through rapid HIV screening and as a gateway to other services, but then also as part of our telehealth PrEP model to support retention and care and increase appropriate laboratory screening rates. Next slide. And so we're going to be doing a couple of different things, and they're kind of working together, so bear with me as I talk you through this. In terms of our Iowa TelePrep program, we have decided to partner with our state hygienic lab here in Iowa, which is a lab we use to process our state's safety net STD testing samples, to replicate and then validate a homegrown test kit similar to the kit that we used in our pilot partnership with Emory University. That validation study is beginning in Q1 of 2021. It's going to rely on patients who are currently enrolled in Iowa TelePrep and who are willing to do dual labs at their intervals of laboratory testing, meaning that they'll utilize a home test kit and they'll also go have traditional labs drawn and collected in one of our public health partnered sites to inform the data of the comparison as part of the validation study. Our providers are going to be able to order and dispatch the kits directly to patients by mail utilizing FedEx or UPS. I can't remember if I actually think that's our one outstanding question on which mail carrier we're going to be using to do that. And this will allow results to be directly uploaded electronically to the ordering provider, which will increase our efficiencies and turnaround time in terms of result reporting. And just important to note here that we're funding this validation utilizing our 340B cost savings from this project. I think this is sort of secondary or ancillary to the topic of today, but I know there's also a lot of concurrent conversations about the potential decline in 340B cost savings related to PrEP programming. And we saw this as an investment that we could utilize 340B revenues in such a way as to validate and then sustain a home testing program that would support long-term retention and care and access for our PrEP patients for much longer than the 340B revenues will be coming in at this level. So we really identified that as a priority for those margins at this time that would outlive you know, the lifespan of how high those margins will be. Next slide. But this also goes into the future of what our at-home HIV testing is going to look like. And this idea is really about, you know, once we validate that kit and we've served the purpose of the PrEP patients that are already a part of our program or that will be a part of our program in the future, we have the opportunity to break that kit down. So investing in this validation of a homegrown kit is going to give us numerous opportunities to use the component pieces of that validated kit in the future, whether that's doing at-home STD sample collection that includes extragenital screening, at-home blood collection that's going to allow for the expansion of HCV testing, at-home standalone, so dried blood spot or microtainer HIV testing in the event that we don't need to utilize a rapid test or we need to utilize a test that has increased sensitivity and specificity as compared to the commercial kits that are on the market. And then it also gives us the potential for more focused PrEP testing that will reduce waste and save costs. You know, I think we all know there are a lot of really great commercial partners or commercial lab partners out there who offer PrEP screening kits, but when we start to look at them, the intervals of testing don't always line up with patient need, and we're really trying to create and sustain an environment where our laboratory testing is focused and based on client need and reported behavior. You know, so that we're not testing somebody for something that they don't necessarily need to be screened for. So all of the things that we've learned through our partnership with Emory, through the Iowa TelePrep project, and through our COVID response at-home rapid HIV testing has really informed this longer term process where, you know, we're going to be going through this validation study for these purposes, so that we have the opportunity to utilize the kit in the way that best meets the needs of our clients, and that also can be used in partnership with our STD and hepatitis programs, because we are an integrated bureau here at the Iowa Department of Public Health. Next slide. And that's it. I'm super grateful to have had the opportunity to come and be here with you all today and with our fantastic co-presenters. So thank you, Kendrell, and everybody at NASTAD. And with that, I'll turn it back over to you for discussion.
Perfect. Thank you so much, Cody. Iowa's model is really a great model to help inform many of these jurisdictions as they either consider or grow their self-testing models for HIV prevention and or PrEP services. So now I'd like to open the floor to the audience, inviting you all to ask any questions or make any comments from today's presentation. We have about 15 minutes left for open discussion. Again, if you are feeling a little bit more comfortable with posing your questions through the chat, again, I invite you to do that. Or we do have the option of you unmuting yourselves. There were a couple of questions that came. First, yes, there will be a recording of this PowerPoint along with the questions after the webinar. Should be available within the next week. I believe this question is for Liz and Janelle. What does low-cost barrier HIV STI testing look like?
Yeah, great question. So we do have a sliding scale fee for service based system, and our sliding fee scale slides down to 0 for all of our HIV and STI screening services.
Perfect, thank you. Well, it's more so of a comment that we can pose to a question. It says, I have tried the outreach profile. Unfortunately, dating apps will delete the profile if it's used for marketing or even show a pill or drug picture. Can anyone speak on ways to combat this?
Absolutely. Janelle, did you want to start?
Yeah, I can go ahead and lead on this one. So in order to prevent the deletion, the pictures that we have are of one of our PrEP navigation specialists. So we have someone who volunteered to have their pictures used in all of our outreach profile. We found that It's successful for a couple of different reasons. One, it's not a picture of a pill so that we're not getting deleted by the applications, but also it provides more transparency because they know that that is a person who works with Howard Brown and that they may potentially work with in the clinic when they come in. The other part of that, for outreach purposes, you will be flagged and deleted if you are the one messaging folks, and specifically if you're messaging folks and asking them for their information. So we wait for patrons on the app to message us, and then we respond. And then to get around asking them for their name and phone number, we give them the link so that they can register themselves online with our HealthVana. The HealthVana link takes you to a specific Howard Brown page, so it's badged and they know that we're also like an actual person from Howard Brown and that it isn't some sort of hoax.
Wonderful, thank you. Another question came in specifically for Cody. It asks, have you considered using telehealth, using the telehealth tool to conduct a full HIV test event that would include collecting the client level data and working with the client on reading the result and then conducting essential services referrals as needed?
Thank you for that question. That's a great question. We did actually explore that at the start of our phase 1 pilot with the at-home rapid HIV testing. So we purchased Zoom Health licenses for our participating agencies and left it up to them to offer that service to folks. And many declined. They preferred to just talk over the phone. They weren't really interested in doing face-to-face. And we've continued to offer either phone-based or video chat-based support to individuals who are conducting the test at home once they receive it. And again, we haven't had anybody accept that as a service offering at this point, and it's not something that we're really interested in requiring, given that we are already collecting all of the test event data over the telephone during the pre-screening. It's informing what's going into the kit that's being distributed, etc. But that's a great question. It's what I thought we would be pursuing in terms of our model, and I thought folks would be more interested in it, but the pilot data is showing that that's not really a driver for the individuals who are utilizing the service.
Great, thanks, Cody. Another question asks, it was curious about accessing this CDC content syndication. So yes, the slides will be available, but Francisco, if you're still on, would you mind talking just a little bit more about the CDC content syndication, what that looks like, if there are any fees possibly addressed with that, and if, you know, any logistics?
Sure. No, you already paid for it. We use tax-paying money to develop all the resources, so it's free of service, and it's basically a Q&A format. And so it could be as simple as, like, you know, the questions of what is PrEP, what is PrEP, et cetera. So you could kind of pick what information you want to transfer over to your website. And like I mentioned, once you connect the dots on the back end, it will automatically, every time we change a statistic, we change terminology. As you know, we're constantly kind of evolving as how we frame things and say things. And so that would automatically be updated to your website. And so there's that URL. Once you get the slide deck, you'll see there's a URL there. Go there. There's a tutorial there. And then also, if you have additional questions, feel free to email that box that I said, you stop HIV together at cdc.gov, and we can kind of point you to the right direction.
Great, thanks, Francisco. And then another question came in for Cody. It asks, how do you get a photo of the result from the client, and how do you identify or verify who it's from based on the phone number? We assume that you aren't getting any PHI via email or text message.
So that's correct, and another great question. We collect PHI in a secured system at the time that the test kit is ordered, and folks are actually given a test ID number, the same test ID number that we use to input the test event into Evaluation Web or Affirm. So they are able to take a photo of their completed test with that test ID sticker when they return it by text or email to the issuing agency.
Perfect. And the next couple of questions are for you, Cody, as well. Regarding Iowa's homegrown test kit, would you be able to talk a bit about the different screening devices or technologies that will be a part of this kit?
I can a little bit. I'll be up front, I'm not our lab guru. I'm really leaning on our STD program manager, George Walton, whose history is in the lab world. I know that the lab was exploring some differences between microtainer capillary blood collection versus dried blood spot collection for syphilis, HIV, and hepatitis C. We learned from our home test kit evaluation project that the blood returns were challenging for some individuals who were part of that initial pilot because of the capillary microtainer collection. So we are exploring potential dried blood spot. We're using the same swabs, I believe the Aptima swabs for 3-site STD screening that we use for our in-person STD screening appointments in clinics, and that's why this has to go through validation, because those haven't been validated for at-home self-collection through our laboratory at this point. I will say, even though I can't speak much about the actual technology, if you drop your contact information to Kendrell, I'll be happy to get that information from our lab folks and share it with you, or just share it with Kendrell to add as a resource with the recording of this presentation. But one thing I didn't mention is the validation is incredibly costly. As somebody who doesn't live in lab space, I was pretty surprised by that. But we do estimate that between supplies and staff time and validation, we're looking at about $186,000 price tag for validating this over a 12 to 15 month period. And that doesn't include client incentives. We'll be utilizing some funds that we have to provide incentives to clients who are willing to do the home test kit and then also travel to an in-person lab for the comparison lab visits.
Great, thanks, Cody. And yes, if you are interested, please just shoot me your information, and then we'll also make sure that Cody is able to plug some of that information in with this question. And then another question, Cody, looks like maybe just a clarifying question. Do consumers photograph the test result and send it in, or do consumers phone results in? And then it asks, what is your rate of returned results?
Great questions. Our preference is for folks to take a photo of the results and either text it to the issuing agency at the phone number that they've provided or to email it. We have had some folks do verbal confirmation of their test result, which is fine, but our preferred method is to actually see it and have somebody be able to interpret it and verify the interpretation via a photo. And in terms of rate of return, I don't have the full data set in front of me, but at our last check-in, we've only had one individual be issued a test kit and not report their result back to the issuing agency. And I know we've looked at some other models where the rate of return is a lot lower. And one of the things that we're really crediting to that high rate of return is that we are doing a lot of relationship building with the phone call and the assessment, and really creating that counselor to client relationship by exploring risk and providing those supportive services as part of the process, rather than having it be sort of independent of the counselor experience.
Great, thank you. We have a couple minutes left, so if you'd like to throw in any last minute questions, we do have a little bit of time. But I particularly did have a question for Howard Brown Health. I wanted to know what was like the community's response to the walk-in model. Do you see a lot of people that come in who wouldn't normally seek services into the clinic? Do you have a lot of people giving feedback on potentially having, granted, given COVID, having resources being brought to them in their particular communities? Can you talk a little bit about that?
Yeah, so The initial response was definitely quite a bit of frustration, but there was a pretty quick adaptation, especially when folks recognized like how smoothly and quickly and efficiently we were able to get folks in and out of their appointments. I think the community adapted to it pretty quickly, and yeah, I think, you know, folks understood with the COVID precautions and setting clear expectations at the door with our triage staff. That was a pretty easy transition. We may end up adapting to this type of model more long because of how smoothly things have been able to go in the clinic operationally wise. But we want to first seek concrete feedback from the community before we make any decisions there.
Thank you. I know COVID is a time where a lot of people are on one side trying to keep things as normal as possible, but also we have this force that is, you know, helping us to look at things in a different light. So thank you for that information.
Yeah, we absolutely, like, after, you know, after the pandemic has passed, but we don't know what post-COVID looks like, we do plan to relaunch our Express sites at our community center and at our Brown Elephant resale shop. So that will also be a resource for folks outside of our walk-in clinics.
Perfect, thank you. And then as we're coming into the last 10 minutes, I have one last question for Cody. Curious to know if a cross-match using self-kit data and running this against other in-house databases has been considered.
I am not 100% sure that I understand the question.
Sure. If you are able to unmute yourself to act specifically, I invite you to do that.
Hey, this is Edwin. I might be able to help with a little bit of context, even though I did not put in this question. But a couple of health departments have entered their self-testing kit data into the HIV surveillance system to understand linkage to care and retention and care later on, or other kind of look at other indicators in terms of outcome. Does that help, Cody?
Yeah, sure, that's very helpful. And actually, because we are doing the full client assessment and we're tracking everything in a firm, this subset of test kits is tracked the exact same way that our in-person testing would be tracked. So we're monitoring PrEP referrals to STD screening and other services. In the event that somebody were to be identified as living with HIV, we'd then have all that linkage to care data and be able to, you know, draw comparisons between timeliness in terms of linkage to care and first labs for individuals identified via home test kit versus traditional rapid test kit versus in-person. Those are all variables that we monitor pretty regularly in collaboration with our surveillance department. But again, because we are collecting a full client assessment on everybody and putting them into a firm, we are able to track those same data variables over time.
Great, thank you. I'll pause for just a couple of seconds to see if there are any additional questions. If not, can I go to the next slide? All right, so again, if there are no additional questions, I'd like to thank CDC, the presenters, and also the participants for joining today's webinar. Contact information for presenters are on the screen, as well as information to request CDC capacity building assistance or technical assistance. The recording for this webinar, slides and questions posed will be sent out within the next week. And the date for the final webinar in the series is forthcoming, and we'll address a topic that looks at innovative strategies for improving access to PrEP monitoring for labs, HIV testing, and viral hepatitis and STIs. Again, I'd like to thank you for joining today's webinar, and we hope to see you all soon. Thank you.